Joseph Aja, a human resource expert, lost his wife in March this year. She took her life after they had been married for close to 17 years. They had 3 children.
And not only was she mentally ill, she committed suicide.
Ajara persevered and supported his wife.
When she would not sleep, I would not sleep. When she would smash plates and cups on walls and throw knives around the house, I was the victim. I was the one suffering broken bones. She would swing the plates until every one last bit of them was finished.
Even after the intervention of the mental health experts, she refused to acknowledge that she was unwell.
Very kind and generous and loving, beautiful, well-spoken, well-educated, and a very successful entrepreneur, a good mother too. But when she would have those episodes of mental illness, the home was impossible to live in pretty much.
Ajala had no idea that she was about to commit suicide on the day it happened.
She stood at the garage door and waved at me for a very long time. The LC Secretary for Women is my immediate neighbor next house. And she says, "I'm sorry, neighbor, but I have to break the news to you. And I can see your wife has committed suicide by hanging."
Ajala's experience is one of the many of the Ugandans suffering disorders related to mental health.
14 million Ugandans have a mental illness. And people are like, really? 14 million? I said, yes, it could even be more.
Because of this, the Executive Director of Butabiika Hospital, Dr. Juliet Nakku, says treatment and lost productivity cost the Ugandan economy 900 billion Uganda shillings in 2021 alone.
At least 137 billion Uganda shillings lost in total government expenditure on treatment of people with mental health problems, and a whopping 770 billion Uganda shillings in indirect productivity losses.
The conference, with a theme focused on making mental health for all a national priority, is organized by the Uganda Counselling Association. Mental health professionals want government to provide more funding towards this problem. The Minister of Health currently receives about 70% of the total national budget. Out of this, less than 1% is allocated to mental health. Jingo Francis, NTV.